Hello. Today we are going to discuss about non-blanching rash of kids, and I think it is very scary sometimes to see non-blanching rashes in the kid, but it's not an abnormal thing. So let's know about it. So it is non-blanching or petechial rash. What is that? It usually not fade under pressure. The glass test is a way to identify this type of rash. When a clear glass is pressed firmly against the skin, rash is still visible and that starts as tiny pinprick anywhere on the body, and it can spread quickly to look like a fresh bruise. So, what are the causes of these types of rash? So, you by home, you can know this is non-blanching or not by pressing with a glass. Now, you would like to know what are the can be causes. It can happen anyone, even the healthy children. However, um, it can be sign of the following condition like viral illness, that is a common thing, coughing or vomiting that can cause in face, eye, this upper part of the body and above the mostly lip nipple line. You can see those. Blood or clotting disorder, meningococcal disease that can cause meningitis, sepsis, etc. Very uncommonly infection with other bacteria and trauma. So sometimes doctor may need to do some test to find out the cause. This will determine the right treatment for the child. Then what test, you may ask, what are the tests you can do? So child may be admitted in ward for observation. That is a common thing that we observe the child and monitor and examine properly that how the child clinically, and may decide to test for blood. That may include blood culture. That means we test that any bug is there or not and observe for 48 hours in the laboratory. May do some urine test, may do some throat swab, may do some throat I've already told throat swab, and also chest x-ray and lumbar puncture, that is for testing meningitis. That is a small sample of fluid from spine. So it all depends upon the examination. Now, what treatment your child will need? Many of them not need any treatment. Treatment depends upon the signs. If you know your child shows some of the sign of some serious disease. So when doctors has found out what is the cause of the rash, then can prescribe your antibiotic. We actually prescribe antibiotic only if you think it is a bacterial infection. Antibiotic can be by mouth or through a cannula. Cannula means a small rubber tube that you usually give in the vein, and wait for the old result to come back. But if we think child has meningitis, then immediately we start that antibiotic through vein. Now, when you always have a question, when I can take my child, we'll see that it's safe enough for your child to go home. When child is drinking, high temperature settle, generally more than usual self. If child's culture has been taken, they may need to stay until the result available. That is maximum about 48 hours. With my child, will my another question, can be your child can any further treatment of home? If they prescribe any antibiotic, then course should be completed, and please check your child at night whether they are okay or not. Keep child away from nursery or school until the rash has gone and child is well. Maybe your child will given paracetamol ibuprofen for few days for any discomfort. Please use that instruction in the bottle and keep that paracetamol or ibuprofen, whatever. Further advice, bring your child if rash is very spreading, become very drowsy, your child is irritable, have headache, and do not continue to improve in next few days, continue to have high temperature, vomiting, and of course you know your child. If you are worried, you have to come back, and that kind of thing. Most of the hospital has their contact number where you can contact and bring the child. Hope this small little talk is helping you to tackle the non-blanching rash. But it is reassuring that not all the non-blanching rash are bad, or clinically when we find they're not that serious, we can reassure you. But it is better always to see by a clinician to make it clear whether your child is safe. Hope this help. Bye bye for today.